Hi, my name is Haley, and I am a family nurse practitioner student. I would like to talk to you today about how we can promote health and wellness around our friends and family and our community. Let's talk about getting the influenza vaccine. Some of you may ask, what is the influenza virus? It's a respiratory virus that is known for its vast spread during the fall and winter months and is rapid from person to person. This virus has two different strains that are identified as influenza A and B. 7.5 million diagnoses were made in the 2020 influenza season. Generally, the virus is spread through large droplets when the individual coughs or sneezes around others without properly covering their nose and mouth. Did you know that the germ can also live on the skin without proper hand washing and can easily affect others by being on doorknobs, telephones, work computers, etc.? The next question some of you may have is, how can I tell if it's a cold or if it's the flu, and when should I seek proper treatment to get help? Typically, when we're talking about signs and symptoms of a cold, patients that present to the clinic generally present with a sore throat, stuffy nose, mild to moderate chest discomfort, and a cough, sneezing. Sometimes they may have fatigue and weakness and a little bit of body aches. Fever and chills are very rare in patients that have a cold. The onset of a cold usually happens gradually and may start with the stuffy nose and move on to the next symptom, but generally can resolve in a couple of days with some over-the-counter cough syrup or allergy medicine. Now, let's talk about what kind of symptoms you may present with if you have the influenza virus. In the last 24 hours, have you noticed that you all of a sudden just feel really sick and you have a headache and your nose is stuffy, and then you've started running a fever of 100 to 103 and your body is aching all over no matter how much Tylenol you've taken? All of a sudden, you start to feel super cold and you just can't get rid of it with even extra blankets. And you just feel really, really tired, and no matter how bad you'd like to get up, that you just don't feel like it. If that's the case, you may have the flu. Let's talk about the incubation period and how many days the flu may last. On your day-by-day symptoms of the flu, on day 0, the patient typically doesn't have any symptoms, but this is when they're the most contagious 24 hours before their symptoms appear. Then on days 1 to 3, that's when the patient typically is more exhausted than they usually are. They've noticed that they've got this awful cough and their throat's just really sore and it itches and nothing helps it go away. Then they feel all of their muscles aching when they're walking and they're thinking, oh, maybe I just slept the wrong way. Typically, that's when you have your first symptoms of days 1 through 3 of the flu. On days 4 through 7, typically your fever begins to come down and your cough begins to improve and you're less exhausted and you feel like you could just run a marathon and the breathing becomes easier. That's when the patient realizes that they're starting to get over the symptoms. Typically, between days 0 and 1 through 3, this is when the patient presents to the clinic with all these symptoms, and as long as you're within your first 48-hour window, we may be able to prescribe you a better medicine to help you get over the flu faster. Some of you may ask, what's the importance of getting the influenza vaccine? Well, it protects you from the illness. It's proven to reduce the severity of the illness and the symptoms that you may experience with the illness. It can reduce the number of hospitalizations linked to the influenza virus. It is a positive prevention for those with existing medical conditions, and it is life-saving for people of all ages, including older adults and children. Who should get vaccinated? That's an easy question. People of all ages should get vaccinated for the influenza virus, especially pediatric patients that are greater than 6 months of age and elderly patients. These two types of patients are the most vulnerable in contracting the influenza virus since they have suppressed immune systems. Also, those with pre-existing health conditions should urge vaccination if it is right for them. Since they already have these existing conditions, contracting the flu could worsen their existing conditions and worsen their symptoms that they may experience, which could result in an influenza-related death. Healthcare workers should also urge vaccination. Us as a team, we can come together in reducing the spread to not only our families and friends, but our patients as well. While getting the vaccine does not promise you that you will not contract the virus, it will make your symptoms less severe to be able to fight off the influenza A or B virus. If you have any concerns about getting the vaccination and finding out if this vaccine is right for you, I urge you to consult with your healthcare provider. It is not recommended for those with severe allergic reactions to take the vaccination, especially before consulting with their primary healthcare provider. Patients on any type of anticoagulant should also consult with their PCP before getting the vaccination as well, due to the risk of developing hematomas at the site of injection. Those with Guillain-Barré syndrome are not advised to get the influenza vaccine due to the risk of vaccination-related complications. Some statistics of the influenza vaccination is that it reduced the risk of severe flu by 76%, and it was effective at also preventing life-threatening influenza. Approximately one half of the population accepted the influenza vaccine and thought that it was safe and a good possibility for decreasing the spread of this illness among other people. The vaccine coverage has also increased yearly. More than 6.5% over the last 5 years have decided to get the influenza vaccine in trying to promote healthcare amongst their families and friends and community. Lastly, the vaccine is always being studied to make appropriate changes each year and being tested against different strains of illnesses. Lastly, as a nurse working in the acute healthcare setting and a future healthcare provider, I strongly urge you to reach out to your healthcare providers and local pharmacy at the beginning of each influenza season to get your flu shot. Together, we as a team can reduce the spread of influenza among our families, friends, and communities, making it a safer place to be able to gather together. Get your preventative health vaccines as soon as they are available to you.